Hi, my name is Isabel. I am an undergraduate of nutrition at Anahuac University in Cancun, and in this video, I'm going to speak on the topic of food policies in Latin America that intervene in the prevention of obesity in children. For this video, I used information from the research paper Prevention of Childhood Obesity and Food Policies in Latin America, From Research to Practice, which I will link below. Now, to be punctual in this video, I would talk about 4 policies that have been implemented throughout all of Latin America in hopes to decrease the incidence of obesity in children and promote healthier habits. I will describe the objectives and benefits of each of the following policies. The first one is taxing on sugar-sweetened beverages and junk food. Second is front-of-package label legislation. Third is trans fatty acid removals from processed foods. And fourth, last but not least, recreative bike paths or open streets. These policies are very important to make since child obesity has become a pandemic in Latin America. Some of its causes include environmental factors such as urbanization, limited access and time for physical activity, and the really easy access of junk food everywhere, as well as the lack of education in nutrition and physical activity in schools and households. We'll briefly talk about important points of each of the strategies in various Latin American countries imposed to resolve this issue. So the first one is taxing on sugar-sweetened beverages and junk food. Of course, children usually do not have money, let alone know what a tax is, right? But this policy's intention is to disincentivize their caretakers to buy these types of products for their children. The National Institute of Public Health in Mexico has researched this policy's effectiveness and found an 11.6% reduction of demand of these types of products. The principal substitutes of these drinks being water and milk. Another benefit of this policy is that the tax revenue can be used for public health in general. So it's a win-win situation for the public, but also the system. The second strategy I'm going to talk about is the front-of-package labeling. This must not be confused with the mandatory nutrition labels that most Latin American countries use and has been used for a very long time. What I'm talking about is a policy that was popularized by Chilean and Ecuadorian laws. And in these labels, they're much clearer, they're easier to understand, they catch your attention very easily. They're very impactful stickers that can be found at the front of a package. And sometimes they're in the form of big black hexagons, or in the case of Ecuador, they're like traffic lights in bold writing, usually highlighting that the product is high in saturated fats, sodium, or calories. So this makes people think twice, and also a child that starts reading can also infer that those stickers mean that it's probably not a good option. Actually, when this policy was created, this also meant that it included restrictions on advertisements of unhealthy food in children, which means that we had to say goodbye to our friends Osito Bimbo, Pancho Pantera, and Tigre Toño. Third is trans fatty acid removal from processed foods. The consumption of trans fatty acids can increase the probability of suffering a coronary event by 23%. This policy is inspired by the action of some European countries of removing this nutrient, and has been approved by lawmakers in Argentina, Chile, Brazil, Costa Rica, and Mexico. Actually, in Mexico, this law was just approved and passed, and right now in April, this law was put in full effect in Mexico. So it will be interesting to see how businesses react to this and how people react to this. So, well, we'll be seeing that here in Mexico at least. And although more research needs to be done on the intake of TFAs, or trans fatty acids, in children, it was proven by an Argentinian doctor called Dr. Marcelo Tabella, that the reduction of these fats could save lives, and research showed that this policy was able to prevent thousands of deaths each year in Argentina. These fatty acids have always been a big issue in junk food. It's actually very harmful to the body in a lot of ways. So I think sometimes policies need to be harsh in order to make people have healthier choices, at least. And fourth policy is called ciclovías recreativas, or open streets. I love this one. This program promotes physical activity in children and family quality time, as it involves closing certain streets temporarily to create a safe space for people to walk, bike, jog, run, whatever, or for any healthy promotion or cultural event. This initiative actually started in Bogota, Colombia, and the United States, and it has had a positive reaction from citizens. This also puts like a pin on future city developments to consider adding these kind of spaces in urban planning without the need of closing streets, because sometimes policies have these downsides. So it's always important to find improvements in policies. Policies are constantly researched in order for them to be improved. These are all the policies I'm gonna delve on for today. We must remember that putting these policies in action is important, as the funding for the research effectiveness of these policies, ensuring that these policies can be improved and have a long-lasting impact on childhood obesity in the long run. So leave a like or a comment if you liked my video, and I see you next time.